So important considerations regarding the child. As I've said, one of the fundamental factors here is the developmental stage of the child. Because age is the most important determinant of a child's memory capacity. And often when one is conducting these assessments, you are relying on the recall of the child around the events that may have taken place. A child's age and developmental abilities influence his or her perception of an event and the amount of information that they can store in long-term memory. Now we know that this improves as children get older, but obviously for a very young child, this is quite limited. So infants and toddlers can recall experiences which they often express in their behavioral reactions to people, events, and circumstances. However, these early memories are not always associated with verbal descriptions, which means that it becomes very difficult for a child at that stage to communicate verbally about the abuse that has taken place, although they may enact some of it. And that's where perhaps we look at methods such as anatomically correct dolls, play, in which they may express some of these behaviors and with sexual themes. Young children are also less able to make sense of unfamiliar experiences. They have a more limited vocabulary and are less accustomed to engaging in conversations about past experiences than older children. So you see, all those factors would make discussing with a young child an event that's happened in the past, especially if it's an unfamiliar event, such as, the sexual abuse hasn't been chronic, quite challenging.